When Valerie Nanono was diagnosed with leukemia 4 years ago, she began chemotherapy. Little did she know that the cancer treatment would leave her with a hearing impairment. The 13-year-old says her heart sank when it dawned on her that she could not hear.
And then at times I began to realize really I couldn't hear. I became depressed about it.
Her mother, Olga Alego, says the chemotherapy, which began in June 2019, made Nanono sweat in her ears. Eventually, her right ear filled with pus.
And then we were putting clothes here to stop the pus from going onto her clothes. The hospital we were going to, at that time we thought we were in UCI, but we were not. Yes. So they kind of rejected us.
The distressed parents rushed their daughter to India for emergency treatment within the same week.
So they tested her and found that she had profound hearing loss. She could only hear bullets, slams of doors only. But when you call her Valerie, a car, she can't hear.
They returned to Uganda after 2 months with a prognosis that Nanono should return to India for cochlear implant surgery. However, COVID-19 struck and the world went into lockdown mode.
There's nothing in the inner ear. There's no cochlear implant, there's no cochlea, there are no ossicle bones, there are no hair cells, the nerves are not there.
As Nanono's condition worsened, her parents managed her at home.
She had lost balance there. So what we did to help her was we said making her do exercise. And then of course people laugh at her. They would laugh at her, they would make fun of her, and then she became reserved. She's a very talkative person, but she started keeping quiet now.
Eventually, they decided to have the surgery at Makerere University Hospital in Wandegea. The surgery, which cost $37,000 or 141 million shillings, was performed on Tuesday. While the actual surgery cost 8 million shillings, the implant cost 135 million shillings.
If a child failed, he can.
Dr. Chris Ndolerire, who heads the Department of Ear, Nose and Throat in the School of Medicine at Makerere University College of Health Sciences, says losing the sense of hearing can occur at any age.
Not everybody needs an assistive device or a cochlear implant. Most of the disease that causes hearing impairment just needs surgical management, and you'll be able to hear again.
For a number of years, Professor Thomas Rowland, who heads neck and head surgery at the Department of Otolaryngology at New York University, has helped train Ugandan doctors to perform cochlear surgeries. This is the first time a case like Nanono's is being handled in Uganda, hence the high cost.
But she must have developed meningitis probably a few years ago. So we had to use a special technique that we've just started using. It just got approval from our government, our NIH, and got grants to do 25 patients. But since it's working so well, I thought I would use it here as well.
The average cochlear implant costs between $13,000 to $25,000.
The implant has a magnet on the inside, and she has an MRI compatible magnet, so she can get MRIs for the rest of her life, and her magnet will not move. So that's the latest model that's out there. It's the 600 series.
A day after the operation, Nanono, who dreams of becoming a neurosurgeon, is ready to face the world. Her receiver and speech processor will be switched on after 1 month, in which time she is expected to make full recovery.
A lot of work has to be done to help you to coordinate the sound with your speech centers. This is when we send you to our speech therapists.
However, the family still has an unpaid balance of 57 million shillings. Without that payment, the hospital will not switch on the receiver. In the meantime, Nanono communicates through an app installed on her phone, which transcribes speech for her to read. GILLIAN NANTUME, NTV Tonight.